Greetings, everyone, and thank you for joining the Technical Assistance webinar for the Health Equity Leadership Development Initiative Notice of Funding Opportunity. My name is Stacy Williams, and I am a team lead in the Division of Program Operations with the Office of Minority Health for the U.S. Department of Health and Human Services. I am joined today with my colleagues, Ms. Sinceri Cobb-Souza, Director of the Division of Program Operations in the Office of Minority Health, and Mr. Dwayne Barlow, Branch Chief in the Grants and Acquisitions Management Division within the Office of the Assistant Secretary for Health for the department. Our presentation slides from today's webinar, along with the list of frequently asked questions, or FAQs, will be posted to the grants.gov webpage. To access the presentation slides and FAQ document, you will need to go to the Notice of Funding Opportunity, or NOFO webpage on the grants.gov website. To get there, you can search in the grants.gov search browser for the phrase Health Equity Leadership Development Initiative, or the NOFO number MP-CPI-23-001. The first result will take you to the NOFO's webpage. You will navigate to the Related Documents tab for the presentation slides and the FAQ document. Please note, we have reviewed all questions that were sent prior to today's webinar. Many of your questions will be answered throughout the presentation. You may enter your questions in the chat box during today's webinar. Also, to ensure fairness, questions received via email and in today's chat will be grouped by category and answered in the frequently asked questions document on the grants.gov website. At this time, I will turn it over to my colleague, Ms. Sinceri Cobb-Souza.
Good afternoon, everyone, and thank you, Stacy. Today's webinar, as Stacy noted, will provide an overview of the Notice of Funding Opportunity. Next slide. The Notice of Funding Opportunity, the competitive application requirements, a review of the competitive application requirements along with the supporting information to be submitted, and a very brief question and answer session. Next slide. Please be informed that the Notice of Funding Opportunity, or otherwise known as the NOFO, is available to provide you with the essential information and guidance regarding applications. It is highly recommended that you read the entire funding announcement and follow the NOFO carefully. Please note that the information provided in the NOFO takes precedence over any conflicting details in other documents. Next slide. The Health Equity Leadership Development Initiative, or the HELDI initiative, projects should implement a fellowship program at the U.S. Department of Health and Human Services. OMH expects recipients to provide training on health equity issues and leadership to early career individuals to improve the health of racial and ethnic minority and other disadvantaged populations. All applicants should review all program requirements, eligibility information, application format, and submission information, the evaluation criteria, and other information in the funding announcement to ensure their applications comply with all requirements and instructions. Next. The HELDI program description. First, we anticipate funding under the Health Equity Leadership Development Initiative, or HELDI, to implement a fellowship program at the department. Next, the recipients will provide training in health equity issues and leadership to early career individuals to improve the health of the service populations. And then finally, recipients will be expected to address the gap in federal fellowship opportunities for individuals to advance health equity and address the social determinants of health, or SDOH, issues through health policies, programs, and practices. Next. Program expectations. A, we expect recipients to develop and implement a health equity leadership development project to support a 9 to 12-month fellowship program for graduate level students and recent graduates who have completed their graduate degree within the previous 2 years. The project should focus on developing skills and creating opportunities for the federal experience in health equity, disparities, public health, and the social determinants of health for project participants. We expect recipients will utilize the OMH curriculum and training modules to educate and engage fellows in health policy issues and processes with a focus on health disparities and health equity, to improve cultural competence and to build leadership skills aligned with core competencies. In addition to the OMH curriculum, we expect project activities to incorporate facilitated professional experiences and supplemental learning opportunities focused on areas such as leadership and technical skills development. Activities may include webinars, guest speaker, seminars, training sessions, or other innovative approaches toward the desired outcomes. We also expect recipients to implement experiential training and federal leadership core competency areas such as leading change, leading people, results-driven, business acumen, and building coalitions. Also to include public health and again, social determinants of health or SDOH. Recipients are expected to provide mentoring and coaching for up to 10 fellows each year to support the development of leadership and technical skills, and also to support a career pathway to leadership. Next. B, provide fellowship project management and oversight. Recipients should develop and implement a process that will provide this oversight that will include, but it's not limited to, fellow recruitment. That is, to recruit potential fellows interested in health equity, disparities, public health, SDOH, through diverse and tailored methods. Second, the identification of the fellow housing options. This is ensuring that fellows have access to safe housing options that are located within a reasonable distance of the host site and near public transportation. Third, collaborate with us, that is OMH, to recruit HHS sites to host fellows that will have a meaningful public health, SDOH, and health equity projects and programs. Fourth, select fellows with OMH approval through an application process that includes an application review protocol and the developed selection criteria. Also, to manage a process for fellow stipend distribution. Next. B, continued, developing and implementing a process to manage the oversight. Number 5, to develop and implement an orientation for fellows prior to the start of their fellowship to include the overview of the recipient's program components. For example, the mentorship, webinars, speakers, expectations for the fellowship, information on housing and stipends, the host site information, and other topics to contribute to a meaningful experience for the fellows. 6, to develop a system to track each fellow's progress during the fellowship relative to the activities that facilitate networking and learning among fellows, develop leadership competencies for advancing health equity, and develop awareness of the federal hiring system. 7, work with OMH to conduct a post-participation assessments with the fellows. Develop activities that sustain and support the fellows' interest in and awareness of federal and other career opportunities in public health leadership. Next. C, participate in the process and outcome evaluation activities. Beginning with the primary outcomes at the individual fellow level, we expect recipients to work with us to evaluate the implementation and impact of the initiative, which is expected to result in the following primary outcomes at the individual level. Increase opportunities for federal fellowship experiences and advancing health equity through health policies, programs, and practices. Increase knowledge and technical skills that align with the core federal leadership competencies. And third, increase capacity and health equity knowledge and practice. D, disseminate project knowledge and findings. Recipients should document the project knowledge and findings to include the implementation process, lessons learned, successes, and challenges. Recipients should communicate and disseminate project knowledge and findings to include dissemination to federal, state, territorial, and tribal public health agencies, policymakers, community organizations, stakeholders, and other interested parties. Dissemination products should be freely, immediately, and equitably accessible to the public. Next. E, the disparity impact statement. It's very important to note that successful recipients, and that is for after the competition, for those entities that successfully compete and are awarded a grant under this initiative, will be required to develop a disparity impact statement and to submit that to OMH within 30 days of receiving a notice of award. The disparity impact statement will use local data to identify populations at highest risk for health disparities relative to this initiative. So again, I want to emphasize that the disparity impact statement should not be submitted with the competitive application. This is an expectation that is to be fulfilled after an entity successfully competes and receives a notice of award. Next, application content. And you can, next slide. The content of the application includes project narrative, a budget narrative, and the appendices. So we're going to focus now on the project narrative content. Next, we recommend that your project narrative include the following components. One, the problem statement, followed by the goals, objectives, and outcomes. Next, the project approach. Next, the organizational capability. And finally, for the project narrative content, the dissemination plan. Next. So let's take a look at the problem statement. We expect that the problem statement will include a description of the scope of the problem addressed by your proposed project, including how it will contribute to the improved health outcomes of minority populations and disadvantaged populations and advance health equity. Also, you should describe how your project will address the gaps and barriers related to diversity in the public health workforce and the expected impact of the project on health outcomes for minority populations. Next. Describe in this section your project's goals, your major objectives, and your associated outcomes. Using SMARTY, that acronym being specific, measurable, accurate, relevant, time-bound, inclusive, and equitable objectives that include baseline data and quantifiable timeframes for achievements. Secondly, you will identify the measurable outcomes that will result from your project and provide specific, quantified estimate of the expected outcomes. Your goals, objectives, and outcomes should link to the activities described in your project approach section and the work plan in your appendices. We will not fund any project that does not include measurable outcomes. Next. Your work plan. You are encouraged to use the optional work plan template or the OWP template to provide a detailed work plan with the goals, objectives, and outcomes for the 3-year period of performance, including major tasks, action steps, or products that you will pursue or develop to achieve the goal and outcomes. Followed by you should describe the approach you will use to monitor and track progress on the task and objectives. Next, for each major task of each year, action step, or product, you should identify the timeframes involved, including your start and end dates and the lead person responsible for completing the task. Your narrative should reflect and be consistent with your work plan and your budget narrative and must describe all years of the proposed project. Next. You should describe your innovative approach for each of the following areas. That is, incorporating the OMH curriculum modules into the fellowship experience, followed by the fellowship-related work experiences, the supplemental learning, the experiential learning, mentoring, and coaching. Also supporting fellowship experiences and work on efforts focused on 1 or more of the following: health equity, health disparities, and social determinants of health, or SDOH. The fellowship orientation and monitoring participant progress throughout the project and post-fellowship follow-up activities. To also include or describe establishing, managing, and distributing fellow stipends, identifying fellow housing options, and outreach to recruit potential fellows with a demonstrated interest in health equity, health disparities, public health, and SDOH. Next. Recruitment and selection. Describe your approach for each of the following areas. First, collaborating with the appropriate entities to identify candidates who are interested in health equity, disparities, public health, and SDOH. Second, developing procedures for fellow selection, including selection criteria. And third, assisting OMH in the recruitment of potential HHS host sites willing to place fellows in public health, SDOH, health equity projects based on their individual areas of interest. Next, organizational capacity. Describe your organization's current mission, your scope of your current activities and capabilities, and how these elements contribute to the ability to implement HELDI. Describe your experience working with recent graduates who have completed within the previous 2 years their graduate degree. Demonstrate your organization's capacity to provide experiential training and health equity and leadership to fellows while providing adequate supervision. Demonstrate your organization's experience or capability in successfully administering grant programs of similar size and scope. Next, demonstrate your organization's readiness to effectually initiate the intended program activities within the first 90 days of the project. Next slide. Also, you should delineate the roles and responsibilities of project staff and subrecipients and their specific contributions toward achieving the project's objectives and outcomes. Also, to describe the areas of expertise for key personnel in reference to the CVs, resumes, or bio sketches that would be submitted with the appendices. Key personnel include the project director, the principal investigator, or the PDPI, and individuals who will oversee the technical, professional, managerial, and support functions and/or assume responsibility for assuring the validity and quality of your organization's project. You should identify the individual who will serve as the PI/PD. For all key personnel, describe each individual's qualifications, competing time commitments, and related ongoing projects. We expect that throughout the award period, the PDPI will have involvement in and substantial knowledge about all aspects of the project. Next slide. You will describe the collaborative partnerships which will support project activities. Describe the role and makeup of partners involved in completing specific tasks. Describe the anticipated level of support and responsibilities of each partner in completing programmatic activities. Please refer to the memoranda of agreement and letters of commitment that will be submitted in your appendix. Next slide. The dissemination plan. You should describe the method that will be used to document and disseminate your project's implementation process, findings, results, successes, challenges, and lessons learned during the period of performance in plain language to the target audience. the general public, and other parties interested in using the results of the project. You should propose innovative approaches to informing parties who might be interested in using the results of your project to inform practice and/or program development, especially to those parties interested in replicating the project. Note, all appropriate findings and projects may be posted on the department and/or the OMH-sponsored website. Next slide. Now, the appendices. Number one is supplemental information supporting documentation for the work plan. It's to be noted that the work plan must address all of the requested content. It should reflect and be consistent with the project narrative and the budget narrative and must cover all years of the period of performance. Each year's activities should be fully attainable in one budget year. You may propose multi-year activities and activities that build upon each other. Still, each project phase must be discrete and achievable within a single budget year. Should include a statement of the project's overall goal, anticipated outcomes, the key objectives, and the major tasks, action steps, or products that will be pursued or developed to achieve the goal and outcomes. For each major task of each year, action step, identify the timeframes involved, including the start and end dates, and the lead person responsible for completing the task. You may use the optional Objective Work Plan or OWP template under Related Documents for this NOFO on grants.gov. Next slide. Number two, the Memoranda of Agreement and/or Letters of Commitment for partners, subrecipient organizations, and agencies. If available at the time of submission, signed MOAs and signed LOCs or Letters of Commitment may be submitted for each partner, or you may submit one signed MOA with all partners that will include the specific roles, responsibilities, resources, and contributions of partners to the project. A signed MOA or LOC should be submitted for each institution, agency, or organization that will partner for the recruitment of the HELDI fellows. If you are unable to submit signed MOAs, you should submit LOCs or letters of commitment. Signed LOCs must detail the specific role and resources that will be provided or activities that will be undertaken in support of the applicant. The organization's expertise, experience, and access to the targeted population should be described in the LOC. Fully executed MOAs will be required within 30 days following the issuance of any award made under this announcement. MOAs and LOCs should reflect and be consistent with the project narrative and the budget narrative and must cover all years of the period of performance. MOAs and LOCs are not the same as letters of support. You should not provide letters of support. Letters of support will not be considered during the review. Next slide. Number three, the organization chart. It should reflect the management structure for the project and will demonstrate where the project resides within the greater organization. In addition, the chart should include the names of partners and their roles and responsibilities and the level of commitment to this project. Number four, the CVs, the resumes, the bio sketches for key staff, and the position descriptions. You should submit the CVs, resumes, or bios for the PD or PI and all other key personnel. It's to be noted that key personnel does not include individuals who provide routine administrative support to the project as part of their broader support of the organization. We encourage individuals to provide their full name, that is first, middle, and last on these documents to distinguish them for the verification and the system for the award management reports. You should submit position descriptions for all open positions that will need to be filled if funds are awarded. Now, at this time, I will hand it over to my colleague, Mr. Dwayne Barlow.
Next slide, please. Good afternoon, everyone. Again, my name is Dwayne Barlow, and we are going to discuss at this point the application submission requirements. Next slide, please. Submission dates and times. So your application is due by 6 p.m. Eastern Time on August 1, 2023. Your submission time will be determined by the date and time stamp provided by grants.gov when you complete your submission. It's strongly encouraged to submit your application a minimum of 3 to 5 days prior to the application closing date. Grants.gov may take up to 48 hours to notify you of a successful submission. If you fail to submit your application by the due date and time, we will not review it and it will receive no further consideration. Next slide. Federal agency substantial involvement. Awards made under this NOFO will be cooperative agreements. Cooperative agreement is a form of assistance that allows for substantial involvement by the program office. Substantial involvement is in addition to the usual monitoring and technical assistance provided under a grant. Next slide, please. Eligible applicants. So with regard to applicant eligibility for this NOFO, any public or private nonprofit entity located in the state, which includes one of the 50 United States, District of Columbia, the Commonwealth of Puerto Rico, the U.S. Virgin Islands, the Commonwealth of Northern Mariana Islands, American Samoa, Guam, the Republic of Palau, Federated States of Micronesia, and the Republic of the Marshall Islands is eligible to apply for an award under this announcement. Private nonprofit institutions of higher education are eligible to apply. Next slide, please. Faith-based organizations and American Indian, Alaskan Native, Native American organizations that are public or private entities are eligible to apply. Public or private community-based organizations are eligible to apply. Public or not nonprofit community-based organizations or CBOs are eligible to apply. Next slide, please. And on this slide here, we provide examples of eligible applicants. I won't go through the whole deck, but here are some examples. State governments, county governments, city or township governments, special district governments, independent school districts, public and state controlled institutions of higher education, Native American tribal governments that are federally recognized, public housing authorities, Indian housing authorities, Native American tribal organizations other than federally recognized tribal governments, nonprofits having a 501c3 status with the IRS other than institutions of higher education, and not-for-profits without 501c3 status with the IRS other than institutions of higher education. Next slide, please. Cost sharing or matching. You're not required to provide cost sharing or matching in your proposed budget. If you voluntarily include cost sharing in your application, you must include in your budget narrative a non-federal sources justification. During the merit review of an application, cost sharing will only be considered in the overall review of the adequacy of the total proposed budget, federal and non-federal share, to support the project proposed. Applications including voluntary cost sharing or matching that result in an award will include the cost sharing or matching commitment on the notice of award at the level proposed in the application. Any change in that commitment will require prior approval of the grants management officer. Next slide. The notice of funding opportunity announcement. As we've stated before in this presentation, the notice of funding opportunity provides information and guidance related to applications. So please read the entire funding announcement, follow the NOFO carefully, and keep in mind, as we stated before, that the information provided in the NOFO takes precedence over any conflicting information in any other documents. Next slide, please. the address to request application package. So you can obtain an application package electronically by accessing grants.gov at the blue URL that you see on the screen. You can find it by searching the assistance listing. It's formerly known as the CFDA number found on page 1 of the NOFO. The assistance listing number is 93.137. Please be sure to subscribe to the announcement in grants.gov so you receive notification of any updates to the NOFO or supporting documents. Next slide, please. Application submission. So OASH requires that all applications be submitted electronically via grants.gov unless an exemption has been granted by the grants management officer. If you submit an application via any other electronic communication, it will not be accepted for review. Keep in mind that grants.gov is a website portal. All funding opportunities and grant application packages are made available on www.grants.gov. An application will not be considered valid until all application components are entered in grants.gov and received by OASH Grants Acquisitions Management or GAM division during the according to the deadlines specified in the date section of the NOFO. You can contact grants.gov with any questions or concerns regarding the electronic application process, or you can call them at 1-800-518-4726. Next slide. So applications must be submitted as 3 files. File 1 should contain the entire project narrative. File 2 should be the entire budget narrative, including supporting documentation described in the budget narrative content section. File 3 should contain all documents in the appendices uploaded in the attachment section of your grants.gov application. Keep in mind that required standard forms do not apply toward your page count limitations in the submission requirements as stated in the disqualification criteria. Next slide, please. Any files uploaded or attached to the grants.gov application must be of the following file formats. So you can use Microsoft Word, PowerPoint, Adobe PDF, or any one of the following image formats: JPEG, GIF, TIFF, or BMP only. Microsoft Excel files will not be accepted. OASH strongly recommends that electronic applications be uploaded as Adobe PDF. So if you convert to PDF prior to submission, you may prevent any unintentional formatting that might occur with submission of an editable document. You can also check the page count of your PDF and or print the file to ensure that the document does not exceed the page limit. Next slide, please. Please remember to be complete and don't leave blanks on forms unless the information is clearly not applicable. The individual submitting the application forms must have the legal authority to act on behalf of your organization. Next slide, please. To ensure successful submission of your application, carefully follow the step-by-step instructions provided at the blue URL that you see on the screen. These instructions are kept up to date and also provide links to frequently asked questions and other troubleshooting information. Next slide, please. Okay, application elements. As far as forms, you have the application for federal assistance, or the SF-424, the budget information for non-construction programs, or the SF-424A, the disclosure of lobbying activities, or the SFLLL, the project abstract summary. Excuse me. With regard to files, for the project narrative, submit all project narrative content as a single acceptable file. For the budget narrative, submit all budget narrative content as a single acceptable file. With regard to appendices, submit all appendix content as a single acceptable file in the attachment section of your grants.gov application. Next slide. Project abstract summary. So you must complete the project abstract summary form provided in the application package. The abstract will be used to provide reviewers with an overview of the application and will form the basis for the application summary and grants management and program summary documents. If your project is funded, HHS will publish the abstract from your form on tags.hhs.gov and usaspending.gov. The abstract may also appear on program office website or other government websites, so do not include sensitive or proprietary information in your abstract. Next slide. Application format. So Please be sure to follow the project narrative format instructions in the NOFO. Your application will be disqualified if it does not conform to the format requirements. You must double space the project narrative pages. You must use 12-point font. You should use an easily readable typeface such as Times New Roman or Arial. You may single space tables or use alternate fonts, but you must ensure that the tables are easy to read. For appendices and budget narrative, you should use the same formatting specified for the project narrative. Appendix documents such as resumes may use alternate formats common to such documents. Next slide, please. The UEI number and the System for Award Management, or SAM. Okay, to register your organization, you'll need a unique entity identifier, or UEI. On April 4th, 2022, the federal government completed its transition to the 12-digit UEI number as the required UEI for registration in SAM.gov. You may begin the registration process, including receiving your UEI at the blue URL that you see there on the screen. An entity registration checklist is available at the second blue URL that you see on the screen right now. You may register in SAM as either an entity applying for federal assistance awards only, in other words, grants or cooperative agreements, or all awards, including procurement awards. Next slide, please. If you're registering a new entity in SAM.gov, you'll need to create a login.gov account if you don't already have one. Keep in mind that the minimum time frame to complete an initial SAM registration online is 30 minutes. The time frame for applicants' registrations to become active is up to 10 days and may take longer depending on volume or if the SAM system flags the information you provide for manual validation. Average time frame for updates in SAM.gov to appear in grants.gov is up to 72 hours. If you plan to apply for this funding opportunity or think you might apply, you should ensure your organization's registration is active in SAM well before the application deadline, and you will be active through the competitive review period. Next slide, please. Keep in mind that your SAM registration must be renewed each year. If you are renewing your registration, your old SAM.gov username and password may not work anymore. So you'll need to create a login.gov account if you don't already have one. Next slide, please. We strongly recommend that applicants check for an active registration in SAM well before the application deadline. If you're successful and you receive an award, you must maintain an active SAM registration with current information at all times during the active award. If you've not complied with the SAM registration requirements, HHS may determine that you're not qualified to receive an award and may use that determination as a basis for making an award to another applicant. Should you successfully compete and receive an award, keep in mind that all first tier subaward recipients must have a UEI at the time that you, the recipient, make a subaward. Next slide, please. Funding restrictions. So if you're successful and you receive an award, by accepting the award, you agree that the award and any activities thereunder are subject to all provisions of 45 CFR Part 75 currently in effect or implemented during the period of award, other department regulations and policies in effect at the time of the award, and applicable statutory provisions. Keep in mind that your costs for the project must be allowable, allocable, reasonable, and necessary direct expenses or indirect costs in accordance with regulations and current policy. Direct costs may be incurred per 45 CFR 75-141 or 414, applicants should indicate which method or rate is used for this application. Please keep in mind that pre-award costs are not allowed, and the current salary limitation is $212,100 effective January 2023. Next slide, please. Budget narrative and forms. Keep in mind that they must be consistent with the requirements of the NOFO. Budgeted costs must reflect proposed activities. Budget line item descriptions and justification requirements are explained in your NOFO. Suggested table formats are included in the NOFO. And we also have information on the plan for oversight of federal awards in the NOFO as well. Keep in mind that budget narrative, forms, and detailed justifications do not count towards your page limit. Next slide, please. Budget narrative informs tips for development. Okay. You must develop an itemized budget using Section B, Box 6 of the SF-424A for the first year of the proposed project. For awards with an anticipated period of performance of 1 year or less, this will be the budget request for the entire project. Provide a budget justification, which includes explanatory text and line item detail for the entire first year of the proposed project. Budget narrative should describe how the categorical costs, such as salary, equipment, supplies, or consulting costs, are derived. Discuss the necessity, the reasonableness, and the allocation of the proposed costs. Next slide, please. For subsequent budget years in an anticipated multi-year project, provide a summary narrative and a line item budget for each year beyond the first. For categories or items that differ significantly from the first budget year, provide a detailed justification explaining these changes. Do not include costs beyond the first budget period in Box 6 of the SF-424A or Box 18 of the SF-424. The amounts entered in these sections should only reflect the first budget period. Next slide, please. Indirect cost methods are described in 45 CFR 75-414. This category has one of two methods that you may select. You may only select one and must clearly identify that selection in your submitted budget. If your organization currently has an indirect cost rate approved by the Department of Health and Human Services or another cognizant federal agency, you should enclose a copy of the current approved rate agreement in your budget narrative file. For the applicant that has never received a negotiated indirect cost rate, you may elect to charge a de minimis rate of 10% of modified total direct costs, which may be used indefinitely. If chosen, this methodology must be used consistently for all federal awards until such time as the applicant chooses to negotiate for a rate. Next slide, please. If your proposed budget requests a rate that is less than allowed, your authorized representative must submit a signed acknowledgement that the organization is accepting a lower rate than allowed. Now, if you want to obtain the negotiated indirect cost rate with the federal government, you may contact the U.S. Department of Health and Human Services Cost Allocation Services Regional Office that is applicable to your state. The CAS regional contact information is available at the blue URL that you see on the screen. Next slide, please. Application disqualification criteria. So if your application does not meet the following requirements, it will be disqualified and receive no further consideration. So your application has to be submitted electronically via grants.gov by the due date and time, unless an exemption was granted 2 business days prior to the deadline. If you successfully submit multiple applications for the same project, we will only review the last application received by the deadline. OASH-GAM has to deem your application eligible. You must complete the required forms in the application package. So that would be the SF-424, the SF-424A, the SF-LLL, and the project abstract summary. Keep in mind that your application must be submitted in the English language and must be in terms of US dollars. Next slide, please. Keep in mind that your project narrative must be double spaced on the equivalent of 8.5 by 11-inch page size with 1-inch margins on all sides and font size not less than 12 points. Project narrative must not exceed 50 pages, and the total application, including project narrative, must not exceed 75 pages. Next slide, please. Keep in mind that your federal funds request, including indirect costs, should not exceed the maximum indicated in the award ceiling per budget period, which is $700,000. Your federal funds request, including indirect costs, must not be below the minimum indicated in the award floor, which is $600,000. If you've included voluntary cost sharing or matching, you must include in your budget narrative a non-federal sources justification. Your application must meet any application responsiveness criteria under Section C3, other application responsiveness criteria. Next slide, please. And for this particular NOFO, there are no other application responsiveness criteria in Section C3. Next slide, please. Okay. Applications that lack the required supporting documentation or submit additional appendix files will not be disqualified from competitive review. However, this may impact your application scoring under the evaluation criteria. So please be sure to follow submission instructions carefully. Next slide, please. Okay, here's a review of the application review criteria that you heard earlier in our presentation. So you have the problem statement, which is worth 10 points, the goals, objectives, and outcomes worth 15 points, the project approach work plan, 10 points, the project approach fellowship logistics, 20 points, the project approach recruitment and selection section, 10 points, organizational capability, 30 points, and the dissemination plan is worth 5 points. Next slide, please. Application merit review. So eligible applications will be reviewed and assessed by a panel of independent reviewers with technical expertise in the applicable fields according to the criteria listed in the NOFO. The merit review process is formal and confidential. Federal staff are available to answer questions and to ensure that the process is consistent and fair, but do not participate in discussion and assessment of the application. At that point, the applications are reviewed first by program GAM staff for administrative and business compliance, and then by OMH program staff for programmatic compliance. Next slide, please. Funding decisions. So the Deputy Assistant Secretary for Minority Health will make final award selections to be recommended to the grants management officer for risk analysis. In providing these recommendations, the Deputy Assistant Secretary for Minority Health will take into consideration the following additional factors. Here it's just one, it's the equitable geographic distribution of projects. Next slide, please. Okay. Upon completion of risk analysis and the concurrence of the grants management officer, HHS will then issue notices of award. Keep in mind that no award decision is final until a notice of award is issued. Keep in mind that all award decisions, including level of funding, if an award is made, are final and you may not appeal. Next slide, please. Keep in mind as well that we're not obligated to make any federal award as a result of this announcement. Keep in mind that only the grants management officer or GMO can bind the federal government to the expenditure of funds. Now, if you receive communications to negotiate an award or request additional clarifying information, this does not mean that you will receive an award. It only means that your application is still under consideration. All award decisions, including level of funding, if an award is made, are final and you may not appeal. Next slide, please. So, funding process as it relates to the review of risk posed by the applicant. So HHS will evaluate each application in the fundable range for risk posed by the applicant before issuing an award in accordance with 45 CFR 75205. OASH will use a risk-based approach and may consider any of the items such as the following as stated in the NOFO. So we'll take a look at an applicant's financial stability, the quality of management systems, and the ability to meet the management standards as prescribed in 45 CFR Part 75. We'll take a look at an applicant's history of performance. We'll take a look at reports and findings from audits performed, and we'll pay attention to the applicant's ability to effectively implement statutory, regulatory, or other requirements imposed on non-federal entities. Next slide, please. The plan for oversight of federal award funds. If your internal controls are available online, you may provide a link as a part of your plan in the budget narrative. We've also included supplementary material in section I2, which contains questions applicants may find useful in considering their plan for oversight of federal funds. Next slide, please. Non-funded applications as a result of risk review. So if we determine your organization does not meet either or both of the minimum qualification standards as described in 45 CFR 75.205A2, and we do not make award to you as a result, we must report that determination to FAPIS if certain conditions apply. Keep in mind that the information reported in FAPIS is available for other organizations to review when considering you for an award. Next slide, please. The notice of award. So, should you receive a notice of award, it notifies the successful applicant of the selection, the award amount, project, and budget periods. It includes any conditions on the award, in other words, requirements that must be met as a condition of receiving the grant funds. And it includes standard terms, reporting requirements, and contact information for OASH-GAM in the program office. Next slide, please. When to contact. Keep in mind the GAM is the official contact for awardees throughout the award lifecycle. All official communication related to the award is between GAM and the successful applicant. Unsuccessful applicants will be notified by the program office via letter. Next slide, please. Okay, we're at the summary and tips portion of our presentation. So, with regard to the project narrative description, please be clear, complete, and concise in the project description. Follow and address exactly what is requested in the NOFO. Don't make the reviewer search for the required information. Generally, the easier the application is to review, the better the rating or score. Keep in mind that reviewers are not allowed to do any external research or follow embedded links. You need to clearly identify the sections of the application and indicate which component is being addressed. Project narrative must also include all required information within the page limit. Do not use appendices to expand your page limit. Next slide, please. Make sure the goals and objectives are SMARTY for your project. That is specific, measurable, achievable, relevant, time-bound, inclusive, and equitable. Activities presented in the work plan should relate directly to the proposed goals and objectives of the project. The program work plan, evaluation plan, and the budget should provide a complete picture of how the applicant will address the needs as well as address the purpose and expectations in the NOFO. Next slide, please. With regard to staffing, staffing should be appropriate and reasonable for the goals, objectives, and activities of the proposed project. Please be complete in describing what the staff will do, the expertise required, and the percent time they will be assigned to the project. Next slide, please. With regard to your budget, the budget should include adequate funds to carry out the proposed work plan, the evaluation plan, and the administrative responsibilities of the project. The budget should be reasonable and relate directly to the goals and objectives of your project. Do not request more funds than are available as listed in the NOFO. The amount is inclusive of indirect costs. The operating budget should be complete and include federal and non-federal funds and projected programming. Next slide, please. Overall, as we said earlier, please include full names, first, middle, and last for authorized officials, principal investigators, project directors, and all essential personnel. Keep in mind the electronic submission is required. Please don't wait until the last minute to begin SAM registration or update your registration. Do not wait until the last minute to begin your electronic submission. Problems could arise. Next slide, please. If you have any questions or inquiries as it relates to the NOFO, for program questions, you can reach out to Dr. Paul Rodriguez. His email and telephone number is listed here on the slide. For administrative or financial questions, you can reach out to me. And again, my email and telephone number is listed below. For questions about electronic submission requirements to grants.gov and applicant support, first and foremost, you can go to www.grants.gov. You can email their support staff using the email that you see, the blue email that you see here on the screen. And if you prefer to speak to someone on the phone, the number would be 1-800-518-4726. Keep in mind to please don't contact OASH program or grants office staff for grants.gov issues because we do not manage that particular site. Next slide, please. So at this point, I'd like to turn it back over to my program counterparts so we can field any questions. Thank you.
Great, thank you, Dwayne. And I would ask if we could go back one slide, please. Thank you. So I just want everybody to be able to see where to direct your inquiries regarding this NOFO. We do have time for just a few questions before we have to close our webinar today. So first question is for Dwayne. What is the absolute deadline for submitting an application in response to this funding opportunity?
Thank you. Applications are due August the 1st, 2023 by 6 p.m. Eastern Time. Keep in mind, to receive consideration, you must submit your application electronically via grants.gov no later than this due date and time.
Okay, thank you. And as we're getting to the close of our webinar, I want to encourage you to continue to submit questions into the chat, because if we are unable to get to your question today, we will provide a response either via the frequently asked questions document that will be posted to grants.gov, or we will respond directly to you. Okay, and this question is for Sincere. Sincere, are applicants supposed to address all of the bullets related to the expectations for this funding opportunity?
Yes, award recipients under this announcement should meet each of the expectations in the execution of the funded projects. Please refer to the NOFO pages 5 through 7 of the program expectations. Thank you.
Thank you, Sincere. And we have one time for one more question. Dwayne, how could potential applicants stay up to date on any updates or changes to the notice of funding opportunity, additional information and resources, or other developments relative to this announcement?
Okay, the best way to stay up to date is to subscribe to this NOFO on grants.gov. Again, you can go to www.grants.gov and click the Search Grants tab in the upper left corner of the screen. Next screen, you can look for basic search criteria fields under Search Grants header in the upper left-hand corner. You can enter the opportunity number and click the search button. And then finally, you can click on the link under the opportunity number header. You'll see a red subscribe icon in the right corner. You'll then be prompted to either enter your username or password or establish one, after which you'll be able to subscribe and then get the alerts.
Okay, thank you, Dwayne. And we want to thank our presenters today, Ms. Sincere Cobb-Souza and Mr. Dwayne Barlow. Please note, we will upload the frequently asked questions document, the presentation slides, and the recording of the technical assistance webinar to grants.gov to the webpage next week. We thank you all for joining us for the Office of Minority Health's Technical Assistance webinar, and best of luck on your competitive application submissions. Good day.